Which requires she makes it. Oh, and then they're like, we need to come to the where do you
Okay.
And I would be doing some classes.
Yeah, that's what we're doing that today. It was like 5 to 6, but we were like, could we like be 5 but not all 6?
They really do.
That's what we said. If this weren't like at noon, we would not have been like,
I don't think we would have been.
yeah, I don't think so at all.
Yeah, I was thinking about doing that. Thank you, appreciate it.
Hey, it's Rob. Hey, nobody's news center, so I'm just asking. Do you guys see me? Okay, yeah, it should be there. Yep, thanks. Bye.
Okay, cool.
Over there. Okay.
Bye-bye.
I understand people in my relationship with the public school. As much as we can, it doesn't mean this. You know, understand people can be spend more than they do. And it happens a little bit. Yeah. Yeah. There's always going to be some differences. If you're paying $2,000 and I'm paying $20,000. Yeah. No, I mean, that's just a comparison. Right. Or where we live here, as soon as you
Yeah, I had to be in a 7 district for this training. For me. Because did you guys use Bit Central? Yeah, we're using that. We're not using it. Yeah, we're using Latitude.
Somewhat
Yeah.
portion.
Right. But they, our playoff server, which is a streaming thing, like a proprietary thing, but they're moving into Bit Central, which is something, I don't know. But it's like NPS. We are using
Good afternoon. My name is Stacy Moore. I'm the Communications Coordinator for Avon Community School Corporation. Thank you for attending this joint press conference today, and we also are thankful for those who are viewing via live stream. Today's speakers include Mrs. Ann Engelhardt, President of the Avon Community School Board of Trustees, Dr. Maggie Horniman, Superintendent of Avon Schools, Dr. David Stockbridge, Hendricks County Health Officer, Dr. Chris Box, State Health Commissioner, and Dr. Jennifer McCormick, Superintendent of Public Instruction. And I'll spell their names for you. Ann Engelhardt is ANNENGELHARDT. Dr. Maggie Horniman is MAGGIEHOERNEMANN. Dr. David Stockbridge is David, DAVID STOPPERICH. Dr. Chris Box is KRISBOX. And Dr. Jennifer McCormick, JENNIFERMCCORMICK. And Dr. Horniman will now come to the podium.
Thank you, Mrs. Moore. Good afternoon. This morning, we were notified by the Hendricks County Health Department that a second student is displaying symptoms of COVID-19 coronavirus. The Hendricks County Health Department and Avon Community Schools are working closely to determine the web of individuals who have had direct contact with the two students. That web has grown very large. While the CDC indicates that exposure to someone with COVID-19 coronavirus is only an issue if the individual is already symptomatic, which the students were not last week. We still believe the most prudent course for our school system is to close all Avon Community Schools through Friday, March 20th. This will minimize any exposure in large groups and will allow plenty of time for our buildings and our buses to be thoroughly cleaned. All practices, extracurricular activities, and school events are canceled. E-learning days will be used to the best of our ability. Avon Community School Corporation uses a tool called Schoology to deliver learning materials through extended closures. We understand that some families may not have access to the internet to retrieve these learning materials. So we have a form available on our website where parents may request learning packets for their students. Only families who are requesting those materials will receive them. Rest assured that our custodians had already stepped up our cleaning protocols last week using EPA-approved cleaners. Our healthcare partners at Hendricks Community Health confirmed that we are using the same antiviral cleaners used at the hospital. Some may wonder about food service during this extended closure. We know that some of our families rely heavily on breakfast and lunch service in our schools. Avon Community School Corporation's Food Service Department is working on to-go options for our students who need food during this extended closure. Cold food packages will be available to all Avon families. Packages will include 10 breakfast, lunches, and meals. Food packages will be available at a couple of our school building parking lots, Cedar Elementary and Avon Middle School North. Pickup times will be Tuesday, March 10th from 10 a.m. to 12 noon. Food packages will also be available here in our Avon Administration Center Monday through Friday from 7:30 in the morning until 4 o'clock in the afternoon. Parents will simply be asked to sign in with name, student name, school building. We will ask our parents to limit themselves to one package per school-age student. We recognize that you have many, many questions, and we want you to hear from our community partners and know that we will be constantly providing updated information on our website. Now I'd like to introduce Board President Ann Engelhardt, who will make comments on behalf of the Avon Community School Board of Trustees. Thank you.
Thank you, Dr. Horniman. I am Ann Engelhardt. I am School Board President, and I first want to say thank you to our many partners in the community, the state, who have provided amazing support from the first phone call yesterday morning to today. Your guidance has been exemplary, and we want to thank you. On behalf of the Avon School Board of Trustees, I want to emphasize that the board members are focused on the health and the safety of our students and staff. We are working side by side with the administration team, our trusted health partners, and the Indiana Department of Education to ensure there is minimal further exposure to our students and staff, and continue receiving educational services despite our unique situation. Thank you for joining us. We appreciate your support.
Now, Dr. Box, our State Health Commissioner, will come forward.
Good afternoon, everyone. I want to thank Dr. Stopovich and Superintendent Horniman for including me in this press conference today. I wanted to take a minute to update you, since it's been since the end of last week that I was updating you on where we were. We had one case as of the end of last week and have added 3 additional cases since that time. You know, the original case was a Marion County individual that had contact in Boston out there with individuals who became ill from COVID-19. Our case here in Hendricks County has a similar contact, and that individual is able to isolate at home. We've had a second case in Hendricks County, and this is the only one that we have that's not an adult, and that individual is also isolating at home. And our third case is in northern Indiana in Noble County. That individual is hospitalized in Noble County there, but stable. All of our individuals are stable at this time. We have tested 30 individuals and have only these 4 positives. Every other test has been negative. We are continuing to monitor individuals that are considered to be at higher risk, and they are on home quarantine, and that is going very well. We continued to work over the weekend when we found out that we had a youth that had tested positive, and we're very happy to engage with Dr. Stoprich and with the superintendent and the school board here, along with their principals here. And we had a lot of very good discussions, and I think that they have come to what they think, out of an abundance of caution, is the best way to make sure that they are protecting all of the youth here in Avon Community Schools. I will say that they are exceeding even that which the CDC might recommend that they have to do. Again, just trying to make sure that we are keeping the health of the students here and the safety at the utmost of every decision that is made. I want to say this is very clear. This is not a spring break where everybody runs out and goes to the mall, goes to the movies, goes to the theater, goes to, you know, whatever museum. We really need, if we're going to have this work, to have these individuals social distance, which means that you go home and you read books, or you play games with your family, or you do your video games, or whatever those activities are that you can do at home, rather than being out in public, because the point of this is to kind of socially distance children and other individuals. I also want to say that most of these cases, 80% of them, are mild. And of those cases that become more severe and unfortunately in some rare circumstances can lead to death, that's usually our higher risk population, those who are 60 and older who have other underlying chronic conditions. So I think that we all should be thinking about, if we're ill, that we stay home and we social distance. That includes grandma and grandpa and other individuals. And as you're looking at your community, are there individuals out there that might need you to go to the grocery store for them, or drop by the pharmaceutical pharmaceutical store so that they don't have to go out right now in public. They may be already social distancing themselves. We really do want to make sure that individuals in our long-term care facilities are protected. And I know you're not here about long-term care facilities, but again, long-term care facilities are a collection of our highest risk population under one roof. So if you're sick, please don't visit. Please call them and tell them why you're not visiting, but please do not do that. And as always, the Indiana State Department of Health will continue to engage any time that our local health officer, our local school systems, our local school boards reach out and be there for consultation and assistance. Thank you.
And now Dr. David Stoppridge will come and speak. He is the Hendricks County Health Commissioner, Health Officer.
Good afternoon, everyone. So I just wanted to, first of all, start off by once again thanking Dr. Box and the entire Indiana State Health Department. We have been on the phone and texting all weekend long, often calling her and her fellow staff late last night. So thank you so much, and thank you so much as well to Superintendent Horniman. We have also been texting and communicating constantly, trying to get her the information she needs and answer any questions that we can and be useful as the Hendricks County Health Department. Like Dr. Box explained what she's seeing around the state, she also gave us a great idea of what this virus is all about. But I think the biggest message I want to tell the community of Hendricks County is we need to prepare, we need to be safe, but we don't need to panic. We really, really don't need to panic. We need to just, once again, distance ourselves to some degree, and that, once again, with this new, with these cases, what I want to say is this is a respiratory virus, okay? This is simply a virus. It can be spread by coughing, sneezing. It can be found on surfaces, but it's still just a virus. It doesn't live very long on surfaces without human hosts. So how do we defeat it? It's pretty simple. We wash our hands. We wash our hands, we wipe down surfaces with very simple cleaners. And we just take basic precautions. I can't tell us enough that I really just want us to not panic, prepare, wash our hands, wipe down surfaces, and everything's going to be okay. I think that's really all I have to say. So, obviously, as the Hendricks County Health Department, we will be available for questions. They will be coming up. Whenever somebody thinks that they may have had contact with a patient, or they think they may have COVID-19, what we would recommend you do is call your office, call your physician's office first, get guidance from your primary care doctor. If they need help, or if you get directed to us, please feel free to call. It's okay. We want to make sure that everybody gets the best information possible. And I think with that, I will pass it along to, sorry.
Dr. McCormick. Dr. McCormick.
You can call me what you want.
Oh, well, all right, thank you. I'm sorry.
Just not Dr. Box today. So, good afternoon to Avon community and to the entire state of Indiana. What I would like to start out by saying is, please be assured, families and communities, that the job of schools right now is the safety, security, and well-being of our students. That is our top priority. It has been, and it will remain that way. I want to thank Dr. Box. She has been amazing to work with and her entire team. She has been very inclusive with the Department of Education. She's been very transparent. She is also sending the message of this is serious, but no need to panic. I also want to commend Governor Holcomb and his team. They have also included us in these conversations. They understand that there are 1.2 million students sitting in our schools and 78,000 educators and a lot of families that are impacted. On that end, I want you to feel confident that your state is doing amazing work in a collaborative fashion, and that is not to be assumed or taken for granted, so I am proud to be a part of that. To Dr. Hormanch and her team, it has been amazing here at Avon from that first call. Very receptive, very inclusive, has really asked great questions and taken a very strong leadership role in making sure that the students here at Avon are safe and secure and things can move on in a positive manner here in the community. Nothing is perfect about these decisions, and there are challenges that come along with such difficult decisions, but I have the confidence in your superintendent and the entire team here at Avon that things will go well. I also know too, a lot of that depends upon the family's response. And so Avon has always been blessed with a community of a lot of families that are very supportive of the school and the decisions you make, and I do not foresee that changing in the near future. As a state, across the entire state, you have superintendents who are very busy, being very diligent in reviewing and sometimes revising as necessary their plans. That's why we plan and we prepare for days and situations like this. And so we are working with our local health departments who have been extremely inclusive and helpful for our local schools, but it's busy. But I want you to know that I have confidence in all of our local state superintendents who will keep students, their safety, their health, their well-being as our top priority. So again, Dr. Box, I cannot thank her enough and her team, and feel very confident in the Indiana's in good hands.
At this time, Dr. Stockbridge, Dr. Box, and Dr. McCormick will take a few questions if you have any.
For Dr. Box, I believe Dr. Hornman referred to 2 students and you referred to 1 student. Can you clear that up for us?
We only report on positive cases.
And Dr. Horman's referral then was about?
There may be another child in the community that is showing symptoms of upper respiratory or lower respiratory infection.
So the second child hasn't necessarily, or at least the test results for the second child have not necessarily come back yet?
I have no further positive tests.
Okay, and can we determine what school that second child was attending?
That is not information that we give out with regards to patient privacy.
Well,
we've received telephone calls and emails from people who say they're calling the hotline number and it's not being answered. Is there a reason why this is apparently not being staffed 24/7?
The hotline is being staffed 24/7 from 8 to 8. It's being staffed by a group of 10 individuals who are taking the calls and taking information. We are adding to that call center from 8 to 8. We'll also be adding another shift from 8 in the evening to 8 in the morning to get additional help, because the person that was taking it from 8 p.m. to 8 a.m. was our state epidemiologist, or the epidemiology team. And that team is trying to take calls from providers and from individuals who have been exposed to COVID-19 cases. And what we're getting is a lot of very concerned citizens asking questions. So I would strongly recommend that citizens go first to either ISDH's website or to CDC's website to educate themselves. Many of your questions may be answered right there. There's just a ton of information there. The second thing is, in addition to adding more call help for that epidemiologist from 8 p.m. to 8 a.m., we're going to be working with our Poison Control Center, who we already work with to take calls, so that if you are a provider or someone who's from a healthcare facility, we will send that call directly to the epidemiologist, and other calls will go through the poison control. If there are definite healthcare questions in there, then we will I use new telehealth that they're using, surveillance system, where they have actually healthcare professionals, nurses on the phone and answering a lot of questions and helping individuals for free across the state to know whether they should go into the emergency room because they're sick enough to be tested.
Sounds like you're overwhelmed.
No, sir, not at all. We're just in the process of gearing up for what we expected.
Can you indicate to us how your investigators go about tracing the web of individuals who may have been in touch with your one positive young student or even the other student who we do not have test results on?
Right, so, you know, it starts with an individual maybe that flew back, say, from Boston and was exposed there. So what flight did they fly on? Then we get that information to the CDC. Then the CDC gets information back to us about individuals that live in our communities that sat within a certain radius of that individual who became ill. Those are people that we're following up. If we have a particular case, we're going, where were you pretty much every minute of the day? You know, did you go to the grocery store? Did you go to the pharmaceutical? Were you at a wedding? Were you at a conference? Did you go watch at B-Dubs, maybe the ball game with everybody, so that we can start to trace back close contacts of that individual. Again, this is usually spread with someone that you came into contact within 6 feet, not just for a brief period of time, but a protracted period of time. And then we actually reach out to those individuals to make sure that they know they may have been exposed, and if those individuals potentially develop symptoms, how they can reach us to know how to facilitate medical care.
Have you been able to trace the young child who was tested positive back to your original case?
And that would all be confidential information that I couldn't give out.
What good is it to close schools and send kids home if they're going out and they're associating with other kids or other families? I mean, parents are out there right now swapping babysitters, looking after each other's kids. What's the good of closing the school if people aren't quarantined?
Well, first of all, I asked for them to social distance. So I understand that they're going to be people that have critical jobs, and they need to go to their jobs, and they may now have 3 children that, you know, they can't leave at home all day. So maybe the neighbor or someone else in the family can help to watch those children. So there may be times that there have to be some groups, but a group of 4 to 6 children is a lot different than a group of 450 kids all eating lunch together, all going to recess together, all going to the same classroom. So the social distancing that we do in smaller groups is very different than what happens in school systems. And that's why I took the time to say, you know, this isn't the time to go to museums. It's not the time to go to watch the movies. It's not the time to go out to the bounce house or whatever else that kids like to do. It really is a time to kind of stay home, hunker down, and do things within your home.
Do we know when either student started showing symptoms?
I'm sorry.
Do we know when the student started showing symptoms?
This most recent student started showing symptoms on Sunday, I believe.
And how do we monitor folks that are self-isolating, or how do you tell folks at home to monitor their individual?
Well, people are being told they're coming back right now from countries like Italy and South Korea, and even from across the state where they've been and maybe been exposed to cases, and they're being told by the CDC to self-quarantine. But the State Department of Health does not get names and numbers for all those individuals, because those numbers are actually overwhelming with so many countries involved in this right now. So what we do though is follow individuals that are isolated, meaning that they have tested positive for COVID-19, and we know that they are stuck in their home. They may need resources from a medical perspective. They may need someone to deliver medicines or food to them, and they may be separated from the rest of their family because they're isolating from their family also.
So do medical professionals, go knock on their door once a day and take their temperature? Do you depend on somebody in the house to take that temperature and report?
We actually make sure that they have things like Tylenol and Motrin and a thermometer and a sheet to actually record this, and then we usually virtually touch base with them. So a lot of times that's over a cell phone, where we can look at them and ask, have you developed shortness of breath? Has your cough gotten worse? What has your temperature done in the last 12 hours? And that usually happens twice a day.
So there are going to be a lot of people in Avon. I mean, last week there were a lot of people in Avon. I'm sure you've all heard. There's so much out there, and we're not getting tested. What happens when you get a call now from someone in the Avon community who says, yeah, I have a kid in the school and I have these symptoms? Are all of those people now going to be potentially tested? How do you separate out?
Right, so that's why it helps if you go to your healthcare provider to talk about your symptoms, because we don't want to, and we already are just because of the flu season. We've already got 85% of our flu tests are still coming back positive in our state. So that shows you we're adding flu on top of the COVID-19 now, and most people that have symptoms, it's going to be related to influenza. So what we don't need is to have every person walking into the emergency room and asking to be tested for COVID-19. First of all, we are still carefully following the CDC's guidance, and that is that we should test individuals that are hospitalized with severe lower respiratory illness with no other indication of what's causing that, individuals that are at high risk, especially individuals that are in a high-risk setting may have been exposed to COVID-19, and then those individuals that we know were exposed to COVID-19 that we are on watch for to make sure that if they develop signs and symptoms, we really want to make sure that if our healthcare professionals develop signs and symptoms because they're going and touching lots of immune-suppressed patients, very elderly and sick patients, that if they develop signs or symptoms, we need to test them. Yes, sir.
What's the long-term plan? Say 4 months from now, somebody's still sick. Do they have to come to school? What's the plan for that?
Right. I think that's an excellent question, and I think that this is going to evolve and we're going to transition as this disease transitions. Eventually, we'll all get to the point where we just kind of live with COVID-19 as a part of the infections that we get during this flu season time, probably. We're not at that point yet, but what I want to say to the public is that your children, what we see with global disease right now across the entire world is that children that get COVID-19 not only do very well with it, but they are great spreaders, that's the problem, but their mortality rate with that or their death rate is below influenza. So that should be reassuring, I hope, to families out there that have worries about their kids, and I know we spend most of our time worrying about children when we have them, even when they're 30 and 31.
Dr. Stockbridge mentioned that the virus doesn't live very long on surfaces. This could be possibly a question that either of you can answer. Can you both address that question and also the question of what the data shows on asymptomatic individuals shedding the virus? Because that's another concern that's out there, that there are all these asymptomatic folks walking around.
So because it is a novel or new virus, we don't have as much information as we do about viruses like influenza and other viruses. So to tell you that it only lasts for 2 hours or it only hangs in the air for 2 hours, I can't give you those specifics about this virus yet. So that is still very up in the air. But we do believe that most of these respiratory viruses can live for a time on a surface, and that's why it's important to wipe those surfaces down. And when you're touching things, not to be touching your face, your nose, your eyes, which we all tend to do, right? That's a normal thing, because that's how you're going to introduce that to yourself. That washing your hands very frequently. Somebody in Washington State told me that their grocery store clerks have to set a timer, and every hour they go and wash their hands with soap and water. I mean, it's if you're ringing out a big, order at that time, it goes off, you're off, and you wash your hands with soap and water. So those kinds of things can really protect not only the individuals that we are seeing, but the individual people that are serving the population.
Dr. how quickly?
The asymptomatic is still an issue out there. We know that there's community spread. So if that is somebody spreading when they're asymptomatic or somebody who has small symptoms, when somebody asked me about a kindergartner, whether they have symptoms, kindergartners can be symptomatic and not know it until their fever goes to 102, and then they're like a rag doll. Then you give them the Tylenol and they feel better and they're running around again. So symptomatic is hard to tell with some individuals. So we don't really understand. That's another thing about the virus we can't specifically delineate.
Dr. McCord? Are there plans in place to address what working parents are supposed to do when kids are off for such a long period of time? And also, is there future plans for Avon's able to do e-learning days, but what like other districts or other schools might not be able to do this? Is there a plan in place for that?
Yeah, it's a great question. So every district is unique. In Indiana, just kind of a ballpark, about 50% of our districts are one-to-one. That means one child to one device, K-12. So that is an advantage. That doesn't mean that that's a take-home device. So that's the other piece of it to have in this conversation. So e-learning is a great viable option for Avon. It may not be a great viable option for another district. So it really goes down to local planning and what makes sense at that local level, and making sure that all options are thought through, in which I have great confidence on our superintendents. The other piece of it is, you better believe we're going to be on the phones talking to each other about what works, what doesn't work, what can we learn from Avon or other districts that may go through this. So unfortunately, Avon doesn't have that benefit right now, but we have other schools in other states that have gone through this. So a lot of learning for all of us, but a lot of that's a local decision.
Dr. McCormick?
At this time, the press conference is going to end. Thank you.